Hi, everyone. I'm Sue Friedman. I'm founder and executive director of the nonprofit organization Facing Our Risk of Cancer Empowered, also known as FORCE. I'm also a 26-year breast cancer survivor. I was diagnosed at age 33. And I'm really excited to talk to you about a topic I am passionate about, and that is finding reliable online health information. And I'm going to introduce you to two FORCE programs. One is called Spot the Boast, and the other is called X-Ray. It's not really about, having X-rays. That's an abbreviation, and I'll talk to you about what that means. So, face it, we all go online for health information, and especially about cancer, and everyone does it, but there's traps when we do it, and navigating the online health information space can be challenging for people. How many times have you seen this? This article on the left in the media is saying, despite the scary headlines, drinking milk won't give you cancer. But the article on the right says, shocking scandal, drinking cow's milk linked to 80% spike in cancer. And I can tell you that both of these news stories were the news or the media covering the same exact research. So which is it? It's contradictory, and it's really tempting to throw up your hands and say, see, nobody knows. But there may be some tips about that we can share with you to help you figure out, is one of these articles more accurate than the other? And the information online is extensive, right? There's so much of it. Like, I did a search for breast cancer and got 840 million different results in less than a second, which is wild. In my lifetime, I can't go through all of that. And oftentimes the notes on the results on the top aren't necessarily more reliable than the ones below it. So what are you supposed to do with that? And it's sensationalized. This was an article on the left that came out several years ago, where in the Jerusalem Post initially, but then it got worldwide media coverage. These scientists that started a company said that they were going to cure cancer in a year. And people who were going through treatment, people with advanced cancers that want something to believe in, they're gonna want to believe in something like this. And fortunately, an outlet like Forbes a year later looked back and said, did they cure cancer in a year? And clearly they haven't. And so, it's important that we take a really keen eye and take a deep dive when we see articles like this before we act on them, because they're sensationalized. They're not really accurate. This is another one where an article said, stop eating asparagus. It's been linked to cancer cells spreading, and that's not true. That is not what the research was about. And we'll talk a little bit more about that when I present our X-ray program. And then a lot of it online is just lacking expert review. People just sharing their opinion, nothing wrong with that, except nobody's really minding the store. There's no expert saying, hey, that may not be accurate. And so that's how inaccurate information can get spread quickly. And oftentimes there are celebrity endorsements, and, a celebrity is someone who has a lot of followers. And so when they say something, a lot of people will click on it because they have that exposure, they have that popularity. But just because they are popular doesn't mean that they're experts in science or in health. And then, the information that may be really accurate and scientifically based is often full of this jargon that's so hard to understand. And even if you could understand it, sometimes you got to pay to get access to it. It's locked behind a paywall. And things are taken out of context. This article here saying Angelina Jolie gene may be linked to Alzheimer's. That's not what the science said at all. This was a research study on mice looking at a new way to look at Alzheimer's research, but they weren't trying to draw a connection. The researchers weren't trying to draw a connection between having a BRCA1 mutation and Alzheimer's disease, but that's what this media article implied. And you can only imagine that, people who have that mutation may be really terrified when they read something like that, but that's not what the science said. And then there's something called confirmation bias. It's kind of like when you go to shop and you're looking for a red dress, and suddenly everywhere you turn online, you do a Google search for something else, and suddenly all these ads for red dresses pop up. Because a lot of these online platforms, the way they work is they feed you more information that they think you're looking for. And so I did this search on, this is a fake platform, but it was a real search that I did, looking at 5G radiation and crystals. And I got all these videos saying that 5G radiation is dangerous, which it has not been shown to be, and that crystals can protect you from it. And there were 76 videos, these 4, and then another 72. And it's really tempting to say, well, that many people said it, there must be some truth to it. But that's not necessarily the case. It's really how the internet works to feed you more information that they think you're interested in so that you will click on it. So because of all of these traps, we developed at Force a couple of initiatives, and I'm going to go over them really quickly. One is called Spot the Boast, and it's really made to help you take that deeper dive so that when someone sends you an article or you find you're doing a search for information on breast cancer, you can take a deeper dive and try and figure out which information is more reliable. And this is where you can find our Spot the Boast initiative. You go to our website, which is facingourrisk.org/boast, B-O-A-S-T. And what you'll find there are some tools to really help you find trustworthy online health information and avoid what we call the boast. And I'll tell you what the boast is. And there's an interactive fun quiz that you can go through and test your knowledge, an infographic and a checklist that you can download to remind yourself and also to share with the people that you care about and your friends and relatives, so that they can also improve how they look at online health information. And this is the infographic, and we tell people how to look for some of these red flags for health misinformation. And this is just a screenshot of what that checklist looks like too. And these are all resources on our Boast website. And when you go through it, some of the things, and I'll go over a few of the, just some tips for now, until you can make it to the website. But we go through how to check the source of the information and things like how to check a URL extension, that thing after the period in dot, like www dot, and it has a name, and then .gov, .edu, .org. And we just give you some tips for each type of URL extension to help you figure out how reliable is this. And next, we kind of talk you through how to look at the content. What is this article about? And give you some tips around that. And so, for example, things like looking for exaggerated language, watching out for red flag words like poison or scandal or shocking, or words that are really too good to be true, like sensational or magic. These can be really red flags that this content may not be reliable. Ways to search to see what the story is about and to see how accurate it might be, and find other resources so that you can fact check that information. And so, for example, remember this really puzzling 2 different articles that were covering the same research study? Well, if you look at the one on the right, it has these words, shocking, scandal. Well, those are those red flag languages. So that is like really sensationalized. It's exaggerated. And looking for that may tell you maybe this article is not as accurate as this one on the left. And then we show you how to check the relevance of the information. Like, does it apply to you? Because just because it's science and just because it's based on research doesn't mean that the findings necessarily apply to your situation. So we walk you through tips and a list of things that you can do to tell how close is this to my situation and how likely is this to affect my medical decision making. And for example, talking you through how to think about what was the article about? Is it about research? And is it about research in a test tube on animals or on people? And if it's research on people, then, was it a big study, a small study? Who was studied? Because all of those things can affect how much research relates to your situation. And then if the article is not about research, what is it about? And we give you tips for fact-checking information that is really more based on someone's personal situation. And then we also go through the red flags of spotting the boast, and that is looking for information that is biased, overblown, amateur, sales-focused, taken out of context, and too soon to be useful. And we talk through each one and give you examples so that, again, you can be someone who can spot that boast before you act on information or share it with others. And for example, amateur. Remember that Jerusalem Post article where those scientists said that they were going to cure cancer in a year? Well, when we looked up the names of the scientists who were being interviewed, neither of them had any experience in cancer before. So that was kind of our red flag that this is probably not accurate. An example, too early to be useful. How often do we see this? This was an article that came out in some new science looking at honeybee venom for potentially treating breast cancer. But they had just identified that compound in the venom, and they hadn't even started clinical trials in people yet. So that's an example of something that's too early to be useful. And we walk you through each of the boasts using this resource. So I hope you will visit our Spot the Boast website. So now I'm going to talk to you briefly about another program that we have, the one that we call affectionately our X-ray program. And X-ray stands for Examining the Relevance of Articles for You. And this is our X-ray website. So you can go to facingourrisk.org/X-ray to get there. And these are the cancers that we cover, and that includes breast cancer and also metastatic breast cancer, but we also cover a few other cancers too. And the reason we did this is because there's this disconnect, a gap between what a peer-reviewed journal scientific article says. Remember, full of jargon, hard to understand. I mean, look at these names: exome sequencing-based screening for BRCA1/2, expected pathogenic variants among adult biobank participants. Wow, that's a mouthful. And then on the other hand, we have the media that's all over the place. There are these traps. They say things that aren't true, but they're a lot more accessible. They may not have jargon, but they may not be reliable. So X-ray kind of bridges the gap between those two extremes. And here's an example. This was a scientific report looking at an amino acid called asparagine, and they fed it to mice that had been injected with breast cancer cells and developed tumors, and they were using it as a model to study breast cancer and breast cancer metastasis. But the next thing you know, the media is saying, bunk this veggie, stop eating asparagus. That is not what the science said. The science was really, really early, and it really wasn't meant to tell people whether or not they should be eating asparagus. And asparagus happens to be a food that has asparagine in it, but there are a lot of other foods with asparagine. And more importantly, the amount they were feeding these mice was a lot. I mean, this did not in any way look like a natural situation that a person might experience, or even that there's anything they could do about it. So our X-ray review, we take that science and we summarize it in plain language. What was that research about? And then we also give it a relevance score. And that tells you, okay, if you're a person with breast cancer, for example, and you're concerned that you may be at risk for metastatic breast cancer, how relevant is this to your decision making? Did this study really relate to people making decisions about what to do, what to eat, about their health? And we gave this a relevance score of low, because there was nothing about this research that was set up to tell you or guide you in your decision making. There is nothing about the research that expressed or even suggested that people with breast cancer should stop eating asparagus or other foods with asparagine. That was not what the research study was designed to tell. We also rate how strong was the science? How conclusive was it? How well was it done? Because all research studies have what we call limitations and strengths. We talk about those. And this was a well-done study, but a small one, and it was in mice. And then we tell you where it is on the research timeline. So you can see this was an animal study in mice. Studies in animals are probably years away from being relevant to people. And that's what we want people to take out of this program is, at a glance, I just saw this article. Does this affect my decision making? We also rate how the media did in covering it. And you can see that this article, there was other media coverage and they did a good job. We give 1 to 5 stars. But you can see the bunk this veggie, this green is responsible for spreading cancer cells to other organs. They did not do a good job of covering the science, and we only gave them 1 out of 5 stars. Then we also provide you with links to what the national guidelines say with regard to, in this case, diet and what you should be eating. Again, focusing on the things that, the guidelines and experts say, we have studied enough to say this is what you should be doing. We also provide questions to ask your doctor. And depending on the topic of the X-ray review, we also link clinical trials just in case you want to participate in research. And then we give you related resources related to whatever category we were covering. And there's a lot of categories. We don't just, cover new treatments. We also cover lifestyle, prevention, menopause symptoms, or other types of symptom management across the board. We have about 300 reviews in our X-ray library. So with that, just a couple of take-home messages. One is champion health literacy for yourself and others. So that means, use our tools, share our tools. Make sure that if you're talking to your healthcare provider and they don't, whatever they're telling you, you don't understand, let them know that. It's important. That is their job, to make sure that you understand the information they're telling them. Always talk with your healthcare providers before acting on anything you read online. Use and share our tips to spot the media boast, and use and share our X-ray program. And I hope you'll visit both.